There were 4 of us with hepatitis C who got together because we were all being treated at a traditional Chinese medicine clinic. But one of the things we decided was that we'd all had problems with information and support, or the lack of it. And we were amazed to find that there was no charity for people with hepatitis C. So we thought, well, we'll start one.
Since they started, and this is now just only 10 years actually, they've been able to put hepatitis C firmly on the map, so that both healthcare professionals and the public have a much better understanding of what hepatitis C is, how it can actually be transmitted and how it isn't transmitted.
I got the all clear in 2006, and from then until now the awareness is much more. The Hep C Trust has managed to change things in, lobby parliament. Just people seem to know what Hep C is now, and I think the stigmatisation is getting less and less.
So we gathered together a lot of volunteers who wanted to do something, and we thought this is a perfect opportunity. And we got them to take on the job of going around their local GP surgeries, because actually GPs will listen to people who are their patients.
What the Trust has done is to make us as healthcare professionals aware of all those other very important factors. It's provided us with information we didn't have. It's provided patients with self-respect, self-esteem, and patients know that there's a helpline that they can phone and access immediate on-call advice whenever they need it.
Graham Foster came to us a few years ago and said, my hospital is filling up with Pakistanis and they're dying of hepatitis C. And we thought, right, we've got to get out and alert these people.
The Hepatitis C Trust, their approach is extremely radical, to the extent that they're wanting to raise awareness in all communities and the South Asian community as well. For example, I was testing in mosques and at the local Asian mailers as well. The festivals, we tested 104 people, from which 4 tested positive to hepatitis C.
We've now just bought ourselves a van that allows us to be much more mobile to reach other populations, like the homeless.
People generally respond to people like Jim and myself who have been where they've been, and it's a positive message, but it's a real life story.
The test is very simple. Come back in 20 minutes and I'll let you know whether you need to do anything with it or not.
It's about clients being able to access the service. We're about to go nationwide, and then you're hitting rural areas where, this is going to be a real benefit.
It might be difficult for people to go to their GP and say, I'd like a test for Hep C, and then be faced with the question, why? So we went directly to the Primary Care Trust and said, we want to make pharmacy testing available.
They then have the opportunistic ability to come and see us inside an environment which is informal. That's quite good. It breaks down barriers. They can come into us at their convenience, and then we can see them on an ad hoc basis.
He started from a very small organisation. 10 years later, the Trust is actually an organisation that's recognised across the world.
We think, because there's been such advances in the drugs for hepatitis C, we can probably shut down in 15 years.
We are people who've had hepatitis C. We know what it's about and we know how it feels to have it.
We need to put the human face to hepatitis C.
Talk to us about it. What have you got to lose?
To have started something and shut it down, then I'll feel proud.